morning, madam.
Good morning. Take a seat. Tell your med number, please.
8962.
The patient that you have examined today, I have examined earlier. So what you are going to tell, actually I know, and I have examined the patient as well. So you can start now.
Authority was given by the Department of Forensic Medicine. The examinee or patient is Kumarage Kalpa Pereira, who is 21-year-old male, whose date of birth is 2001, February 18. His address is 11A First Lane, Mount Lavinia. His national identity card number is 112244. He is working as a cashier at the Date of incident is 16th August 2022 at 12 pm. Date of admission is 17th August 2022 at 12:45 pm. Consent was requested to obtain history, to examine and to divulge information on MLEF only to relevant authorities. History was given by the examinee or patient himself at Accident Service Unit, Colombo South Teaching Hospital at 8:15 am on 17th August. History. On 16th August at 12 pm, the examinee or patient got collided with a car from his left side while he was driving his own motorbicycle at a speed around 50 to 55 kilometers per hour. After attending a party at the evening. After the collision, he fell on the road from his front side and was dragged few meters away. There were no loss of consciousness, no memory loss, but faintishness was associated. He had bleeding from his mouth but not from his ears or nose. Also, there were no vomiting, headache, vertigo, insomnia or altered behavior. He refused taking alcohol for past 24 hours but was fatigued due to the party and was wearing a helmet, but it was not a full-faced one. Also, he has smoked 3 hours before the accident, cigarettes. He did not see the car coming because there was green lights at the traffic lights where the incident happened. There were lightning road lamps and it was not a rainy day. There were people at the sides of the road and road was busy with vehicles. His motorbicycle was in a good condition and was serviced 1 week ago. Regarding past medical history, he has no history of diabetic, hypertension, seizures or syncopial type illnesses. Regarding his drug history, he was not any regular medications and he is not allergic to any food, drugs or plasters. Regarding his surgical history, it is not significant. Regarding his social history, he lives alone at a boarding place and his father and mother lives at Dikkoya alone. His income is adequate for him, which is 25,000 per month. He has full insurance for his motorbicycle and willing to get a compensation. Regarding observations, though he denied taking alcohol, I had a special emphasis regarding that, and there was no alcohol smell from him. He was wearing a white sarong. His behavior was normal. X-rays of skull, left leg and chest was taken and I will describe them at relevant places. Trace evidence was not taken. Regarding clothing, he has changed his original clothes. Regarding general examination, he was an average built male and was conscious and rational. Also, he was pale and afebrile. Teeth examination was done by opening the mouth and he was not in pain, but I was unable to elicit any damage to the teeth. Regarding systemic examination, I had a special emphasis on his CVS examination and there was no abnormal heart sounds. Also, his pulse rate was 72 beats per minute and blood pressure was 110 by 80 millimeters mercury. Also, I had a special emphasis on his respiratory examination as well. There was...
So, why did you do so?
Because madam, he has a chest impact because he was dragged on the road in his front side, and there was injuries also on the chest also. That's why I put a special emphasis on those examinations.
Right.
There were, regarding respiratory examination, there was bilateral vesicular breathing with no added sounds. Respiratory rate was normal and it was 12 per minute, and there were no signs indicating pneumothorax or hemothorax. Also, he was oriented to the relevant time, place and person. There were no headache or no altered consciousness. Regarding musculoskeletal examination, he could move his left toes passively, but there was tenderness. Regarding injury description, there is a fresh, elongated, superficial laceration 1 cm into 0.2 cm in size at the left side lower lip. Its center is 3.5 cm from the tip of the nose and 0.5 cm from midline. It is placed obliquely downward to left. It is red in color and surrounding is swollen. According to him, his left side lower first incisor tooth is mobile, but I could not elicit that. There is a fresh graced abrasion elongated in shape on middle third of left side of chest. It is 7 cm by 2 cm in size, and the center is 5 cm from midline and 24 cm from medial most prominent part of left collarbone, placing downward and inward obliquely. It is red in color. There are epidermal tags in lower border, but no features suggestive of underlying fractures. Also, there is a full POP cast in left leg from middle third of leg to base of the toes. It has no windows. According to X-ray number 43030, there are fractures in the left inner and outer bones of leg, which is tibia and fibula in medical terms. Regarding referrals, I would like to refer the examinee to an OMF surgeon to identify any damages to the tooth. And also I would like to refer the examinee to a consultant radiologist and a consultant orthopedic surgeon. That's all my history, madam.
Right. Can I take your MLR and MLDF?
Yes, madam, sure. It's here.
Yes, you have mentioned the short history. Yes. So what do you think about the category of hurt?
Madam, I think as in this situation, for now, the category, because he has a fracture, the category of hurt can be grievous under limb H and limb I. But I also have to wait to the OMF referrals done and to get an idea whether there is any damages to the tooth, and then I can decide the category of hurt properly.
So the type of weapon, the force applied is?
The force is blunt force.
Right. So do you think that the injuries are compatible with the given history?
Yes, madam, injuries are compatible because the left side and the front has the more damages, so
right.
It's compatible.
And now this is regarding a rider of a motorcycle. So any common fractures that you can see, especially over his head?
Madam, because of the chest impact, these motorcycle riders are often present with hinge fractures in the skull.
Say it again.
Hinge fractures in the skull, base of the skull.
Yes.
Because of the chin impact on the road.
Impact.
Yeah.
Right. Right. Now time is up. Your examination is okay. Can I have your logbook, please?
Thank you, madam.